Jai Hind and welcome to Dev Talks. This is Aadi. Chinese are going through a COVID crisis, and that is something that we need to first understand, analyze, and figure out what the future moves of the Chinese would be. There have been a lot of things said about China in terms of its COVID handling since the beginning of the zero COVID policy. Xi Jinping had basically said that that is the policy that the Chinese would follow, but it seems like that particular policy has backfired. We have discussed why. We've discussed the impact that happened with the Chinese people coming down on the roads and literally protesting for their freedom from the zero COVID policy. Now that they've got the freedom, are they really enjoying it or are they not able to do so? What is actually happening in China is something, as I said, we need to understand, know about, and be careful about. Please understand that. We've just had a Chinese misadventure in Arunachal. We don't need another one. But before I begin, I'd like to request all of you guys, please like this video, subscribe to this channel, and of course, yes, if you can, do help out the Dev Talks efforts by, you can become a member, or you can send us some super stickers or super chats, or you could directly contribute to me on the UPI number mentioned on your screen. So before I get into, I of course need to get into a presentation, and let's start our discussion with regards to what is happening in China. Now, the basic thing that we saw in the last couple of days was the change in the zero COVID policy, right? The Chinese said, okay, fine, fair enough, you guys win. The protests were happening. They said, okay, you guys win. We're going to change the zero COVID policy and we will open the entire country up. Now, of course, they didn't tell the protesters that you won, but that's what we infer out of this entire thing. The protests were pretty solid, and I've covered those protests in a video where I actually threadbare the history of protests within China. Of course, I've also covered those protests with Major General Rajiv Narayanan and Lieutenant General Ravi Shankar. If you guys haven't seen that video till now, please do check it out. It's going to be under a playlist called China Watch in YouTube, so you can just go there and check it out. Right? Let's basically what I'm trying to do is analyze the impact of the change in policy. The Chinese would have changed this particular policy to ensure that the economy kind of jump starts, it opens up, and the sinking economy of China would get some respite out of industrial movement. Last month in October, basically, one report came out. Sorry, in November, the report came out where the Chinese exports had fallen. Now, that's a very dangerous trend for the Chinese because China is basically an export driven economy. They don't have much of an internal consumption. As a matter of fact, that's why the Chinese came up with something called the dual circulation plan, where they plan to actually export as well as try and increase the domestic consumption of their products. Let's get into it. Now, before I do, of course, these are some cartoons I want us all to remember before we actually get into this discussion. These cartoons were publicized by Global Times and many other Chinese mouthpieces in China and, of course, around the world. Chinese, of course, as of all of us, we know, have enough and more agents to kind of do their dirty work around the world and take care of their business like this. So this was something that I wanted to actually show you. And the second one, which actually hit pretty hard at home, that the Chinese were firing rockets, and what was India doing at that time? Of course, we had a tough time during the second wave. There is no question about it. But look at us right now. 1.5 years later, or a year later, actually, 1.5 years later, we roam around without masks. India reported, last I checked, about 200 cases in the entire country. We've not had any major outbreaks worth reporting or worth discussing about in the past some time. Actually, after the Omicron wave, we've not had. Our vaccination rates are high. Our vaccines are effective. That is the difference between the rocket and what we see today. We fired a rocket and they didn't. This is another cartoon just to start this video on a light note. He says, are you worried about finger 4? No. Finger 8? No. Finger 5. Excellent cartoon, whoever's made this in the Times of India today. Right, let's get into business now. Now, what I'm going to just pluck out certain articles that I've been collecting over the past couple of days since this thing, opened up. They opened up their policy, and let's see what these articles actually put together and show us a little picture. The first one is in the BBC. Of course, BBC is picking it up from one of these Chinese mouthpieces. China COVID health experts predict three waves. Now, this is an epidemiologist in China whose name is Wu Zun Yu. He believes that the current spike of infection will run till about January. And of course, January is till then is basically the first wave. The second wave will get triggered after the Chinese New Year, which, Chinese go all over the world, and that's when the first pandemic actually in 2020 started. And of course, the third will be when people get back to work after they come back into their homes and stuff like that. So that's something that the Chinese themselves are saying. Uh, this is an interesting line. It says frontline medical workers are being told to come in to work even if they have the virus themselves because of staff shortages in China. A Chinese professor specializing in health policy has been monitoring the crisis in his home from Yale University in the United States. Companies are telling their employees that they should return to office, but many don't want to. And this is a scenario that we will actually look at continuously during this program, that the Chinese seem to be, the people seem to be a little reluctant to go out. They are aware of the situation outside, they are aware of the surge going on, and they're saying, yeah, if we go out, it's going to be a problem for all of us, so let's stay at home and stay safe. How long will they be able to do that is another question. The Chinese last week also said that the spread of COVID is impossible. We can't count so many infections. As the infections are going crazy, health officials ease recording of asymptomatic. Now, this is interesting, yeah. What the Chinese have done is anybody who's asymptomatic and comes positive, they don't even record it. They say, okay, you go home and do what you want to. People only who are symptomatic are being reported and put into the hospitals. Now, somebody is actually written today, right now itself, that the bodies are piling up and hospitals are, it's becoming a little bit of a problem. You can imagine if they're only taking symptomatic patients, you can imagine with an Omicron wave, I don't think that kind of hospitalization happened anywhere in the world. This wave, of course, was fast spreading, but it wasn't as heavy because a certain amount of herd immunity was achieved during that time. Chinese seem to be facing a bit of a challenge in this particular thing. It says China has stopped mass testing and only recording positive cases at hospitals and fever clinics where the patient has COVID symptoms. So, as I was telling you, asymptomatic cases and positive results from home testing kits are not recorded in the data. Temporary health centers are being set up along with intensive care facilities. It's happening after the lockdown, so called, has been opened. This is interesting. I mean, if you look at and I'm going to take comparatives with the Indian policy because that's what they did. They mocked us, so I'm going to try and not mock them, but compare what we did to what they're doing. Now, the first lockdown in India was actually termed, and rightly so, as the time when India wanted to get ready for the eventual COVID surge. And that's exactly what happened. We got ready with our masks, our PPEs. We had issues with oxygen, fair enough, point taken. But a lot of other things in terms of ICUs, ventilators, medicines, and a whole lot of things in terms of the prep was done by the end of the so-called first wave, which ended in 2020. By the time we hit the second wave, there were issues, but India was far more prepared to handle that entire surge. It also says it has been reported that Shanghai alone has a 230,000 hospital beds that have been made available. Now, this is an additional thing. I'm sure a lot of us who follow China would have seen these videos of these massive construction which has been taking place. As a matter of fact, there were videos where the Chinese were trying to break it down. I don't think they're doing that anymore. So that's a very interesting data that we are seeing, that they are constructing these things now rather than they would have done it before they actually opened the lockdown. So that's China for you, ladies and gentlemen. China study says adopting a US stance would trigger a COVID surge, may see a 630,000 cases a day with US approach. Now, how did US handle it? They partially opened, and they had, daily testing and this, and there was a lot of confusion within the US policy approach towards opening up. We remember the time between Donald Trump and Joe Biden. We all remember what all was happening and what all was being spoken about. So the Chinese are trying to compare that particular scenario with their own. Researchers are very critical of an overconfident Western approach. As I was telling you, the Omicron variant of the virus has begun to run rampant through several bigger cities in China. The sudden U turn by President Xi Jinping, former zero COVID policy of containment earlier this month, the surge in infections is the largest in the capital, Beijing, where more than 22 million people are infected by some estimates. Now, that's, a lot of people. 22 million is a large section of the people. We don't have data in terms of how many people are actually hospitalized in ICU or anything like that. China, they will not put this stuff out if they're not even recording the asymptomatic. So one can only imagine. Now, China is a bit of a challenge in terms of healthcare. Uh, their people have a certain culture. Now, see, every country, and I'm not going to blame them for this, but every country is different. In India, a lot of phone call medicine still happens. People call up their family doctors and say, "Yaar, thoda fever ho gaya, kya karoon?" Or he'll say, "Okay, monitor it for 2 days, have some paracetamol, relax for a little bit. If it doesn't go, then we'll see what needs to be done." China does not have that kind of culture. China will want to go to a hospital with mild symptoms, light fever. And that's something that we've been seeing. These amazing photographs that are coming out of China, and which tells you a lot about the Chinese setup for their so-called firewall, with all this stuff leaking outside China. It's interesting. So that means a lot of the VPN has actually spread into China hardcore, and that I find is a very interesting cause, which would have been, I would say, perpetrated, or I would say been introduced into the Chinese society because of these harsh lockdowns. The Chinese would have really wanted to find out what's happening outside. And the only way to do that for them is to get a VPN and connect to wherever they have to. The Chinese COVID situation, long queues at fever clinics as the country mulls expanding hospitals and ICUs. So, as I was talking to you in the previous slide, the Chinese are today trying to expand their setup in terms of their ICUs, in terms of their hospitals, and so on and so forth. And this is when the surge is starting. Um, the Chinese claim faster construction and faster and this and that, but when the construction people are going to fall sick, who's going to make that? So it's going to be a challenge for the Chinese to go forward and actually fight with time. As I said, expansion after opening, facing COVID surge, China expanding hospitals and ICUs. A cabinet meeting on Thursday. So Thursday means last week. This report is from the December 11th. Calls for full mobilization of hospitals, including adding staff to ensure their combat effectiveness and increasing drug supplies, according to the state media. China today has about 138,000 intensive care beds. The Director General, Bureau of Medical, Medical Administration of the National Health Commission, Yao. Okay, I'm sorry, I don't know how to pronounce that, but that's what he said. With a surge like that, and certain reasons why the Chinese would be facing quite a lot of hospitalizations, we'll discuss as we go forward. There are certain predominant reasons that have been identified why the surges in China and why this particular infection in China would be a lot harsher than the rest of the world. By the end of the presentation, you'll kind of understand what I'm talking about. But interestingly, we also need to understand that the Chinese are in this soup right now. There is no, I mean, there's only one other way, which again is going to be a harsh lockdown, and you know what's going to happen after that. So they have a problem, and they've got into this without a plan. They had a plan called zero COVID, was whatever said and done working for them till whatever they did, but now they have a serious issue. China's megacity new work rule for COVID patients marks a big U-turn. Now, this was a big news that was reported by the French press. People with COVID-19 systems in one of China's largest cities can go to work as normal. Now, I want to ask what is normal. The state media reported. Okay, the world's most populous nation is unwinding years of hard coronavirus policies. Now, the authorities admitting the outbreak is impossible to track in the southern mega city of Chongqing, home to around 32 million people. They're telling people, please come to work. We don't know if you're not sick, come to work, and that's it. So you can imagine this is the situation because now China has a bit of a conundrum. In India, again, we had taken this stance lives over livelihood first, and then it became a balance between lives and livelihoods. When we look at stuff like this happening in China, it doesn't seem like the government has actually thought through the lives over livelihood or the livelihood over lives. Previously, they tried to do it. We don't want any people to die, so everybody stay at home and this and that. Of course, what all they did was a different story to ensure the compliance of that zero COVID policy. That's a totally different discussion. Today, they want to actually get the livelihood going up again, get their economy going up again, but they're not able to because of a lot of these issues. Reports of Beijing COVID deaths fuel speculations of China covering up data. Now, that's not news. A lot of us will say, yaar, Adi, kya kar raha hai, yaar? That's not news. Everybody knows. But here is some data. The Beijing's Dongjiao funeral home, which is like a main place, cremated 150 bodies on Wednesday. So this is the December 18th. Uh, Wednesday is a referral for all of us to understand with 30 to 40 COVID, 30 to 40 with COVID. A worker who asked not to be named to the Financial Times. So this is a compilation report that has been done by Bloomberg. COVID deaths are being prioritized for cremation and okay, let me rephrase that. COVID deaths are being prioritized for cremation. I actually wanted to stop on this. Now, this is interesting. Why are they wanting to actually prioritize? One is, of course, a safety feature. You keep them, a lot of infection can happen, but it is also the factor that the Chinese would want to get rid of, what, as fast as possible. The reporter saw body bags at a hospital designated for virus patients. Those of you who follow me, I have tweeted out a video today which is mind-boggling in terms of the kind of death toll that the Chinese are seeing, and it's a sad state of affairs. The Chinese reported 235 new deaths and stuff like that, but I think that was in that one room itself. So I don't know. A lot of these funeral homes were designated by Beijing health authorities to cremate those who are die after testing positive. So they've specified certain areas where the citizens should go and do. I mean, sadly, what is required to be done. Now, interestingly, I think some of you are commenting about the vaccines. That is very, very interesting because this is a WHO approved vaccine. So I don't know, has the WHO gone wrong, or I don't know. Anyways, this is what the Chinese people say. I don't trust it, and this is not now, right? The Chinese people, the Chinese Communist Party claims a double dose vaccination for 90% of the people, but the triple dose booster in terms of when you're going through a surge is just about 35 or 40% people. The worst part is the elderly, which are above 60 years of age, just about 46% of the people have actually had vaccines. So I don't know who they were giving it when they're talking about 90% vaccination, but people don't want to. Now in late November, hashtag Sinovac Max vaccine counterfeit surged to 5 million views on the Weibo, with many posts discussing lumps of hair loss allegedly caused by the locally made vaccine. This particular vaccine has, I'm not sure if if I remember correctly, but at least about some 150 different side effects. A lot of countries tried it. For example, the Middle East did, but they had to actually go back and get other vaccines from other countries to, safeguard their population. They were not able to do it with the Chinese vaccines. We have another neighbor who's used a lot of Chinese vaccines as well, so we should be worried. That particular worry we need to discuss, as I said, towards the close. Now, this is Dr. Ering Flieg Ding. I'm sorry, but sorry, Mr. Eric, if I messed up your name. I'm sure you would to mine too. Anyways, he tweeted out this very distressing video. Look at the people there. Pretty much, their hospitals are completely overwhelmed. China, ever since the restriction were dropped, epidemiologists estimate 60% of China, that is 10% of the Earth's population, likely infected over the next 90 days. Deaths likely in the millions, plural. This is just the start. And he's written a whole thread. I didn't want to put the entire thing, but I think all of you guys would get the gist of what I'm trying to say. To estimate a virus's transmissibility, now this is a bit technical, but it'll help us understand where the surge is in China. Scientists often use a parameter called the reproductive number, or R number. Basically, the R number tells you on average how many people one sick person infects. So, for instance, at the beginning of the COVID pandemic in the early 2020, the R number was about 2 or 3. At that time, each person spread the virus to 2 or 3 people. During the Omicron stage, the US R number had jumped to about 10 to 11. Scientists at the China National Health Commission estimate the R number of the currently situation in China at a whopping 16. We know how the USA was, USA was always far ahead in India in terms of uh, the case reporting and stuff like that. And they were at 10 and 11. You can imagine what's going to happen with 16. And this is the start of the wave right now. So when the wave actually comes into its peak, which is what is expected by somewhere mid of January, I wonder what's going to happen in China. Streets are deserted in China's cities as new COVID surge looms. The Chinese people refuse to go out. People who have money, they're saying we're not. You work from home. People have left jobs, by the way, not just so they can't do this. I mean, a lot of people are running away from China into places like Singapore, into places like Thailand, into places like Vietnam, into places like, of course, America and Europe, which is the golden passport, the rich and famous. Not the famous, but the rich in China do that pretty often. China is also likely to record 1 million COVID deaths by 2023, predicts a new model. Now, this is a model that was done in, Institute of Health and Metrics. Uh, they're saying China could register 322,000 deaths by the 1st of April. For a country that has officially reported about, I think, 5,200 odd deaths till now, that's going to be terrible. Unless the Chinese have been hiding their stuff and they have already seen these kind of deaths in the first wave itself. We are not aware, because we know there has been a certain disparity in their data in terms of their population, in terms of their vaccination doses administered, as well as the cases and all that stuff that they were reporting. And finally, the birth rate that they reported some time ago. So there is a mismatch in these kind of figures, and that has been spoken about multiple times by a lot of people. People have called them out. That's, I guess, one of the reasons why Chinese are going to do this selective reporting. So people cannot figure out a trend line and analyze what's actually happening in China. 3 different news in this particular page, one from Bloomberg, one from Financial Times, and the second one is from Nikkei Asia. Bloomberg says, why didn't China prepare better for the COVID chaos? I just asked that question. Why didn't they do it? They're supposed to be Chinese who think 50 years down the line, right? That's the line we've been taught all our lives, that the Chinese are so good. They think far ahead. The country's communist system excels, it seems, as mobilizing resources to fulfill the leadership's top priority. Is it so? Really, the BRI was a top priority, and what they did to it is another question. But not so good at multitasking. China runs low on blood supplies after COVID donors stay away. I mean, that now is a sign of a country which is going to go into each for his own self, because people see the impending doom. I mean, this is something that you can compare with India. Even in the worst of times during the second wave, you look online and there were people ready and willing to help. There were people making phone calls out of their own time, trying to figure out stuff for one another when somebody was in crisis. China is running low on blood supplies. It tells you a lot about the society and the cohesion that society feels for itself. No ibuprofen, no aspirin, absolutely nothing. China's COVID-19 patients feel pain of drug shortages. Of course, there's been a little bit of a trend in China since this thing was removed. A lot of Chinese people said, "Acha, ab to bahut case badhenge." Everybody, like in India, when stuff happened, we all ran to the this thing and bought up all the masks. These guys bought up all the medicines. So there's been a huge shortage, especially in the Beijing area, with regards to these medicines. Now, I don't know whether they've actually bought them to use or bought them to keep as a backup in case something happens. Both ways, medicines are off the shelf. Now, this particular thing was very interesting to me. This was an article that I found in, I think it was in the National Interest in USA. It says that the US is worried about what is happening in China. China is extremely vulnerable right now because of its population, especially the older adults who are most likely to suffer severe disease, is undervaccinated, has no natural immunity from infection, and a limited supply of treatments. Of course, the Chinese believe in Chinese therapy and the old Chinese traditional medicine to kind of treat all this stuff. I don't know how good is it or bad is it, and I would not want to comment on that. But anyways, let's just leave that apart. Experts predict hundreds of millions of infections, as many as 1.5 to 2 million deaths. So we saw 322,000 deaths at the first there. That was probably at the first wave sort of a prediction. Here they're talking about 1.5 to 2 million deaths. That's a lot of people. Even, I mean, I don't think the United States has even reached that spot. Uh, Guys, I'd recommend please throw in your analysis as I'm going through. I'm going to reach the end of the slide so that we can actually continue this discussion uh, with your inputs and see your comments and see your thoughts as to what I'm trying to tell you here. Because the gist of all this stuff right now, I'm actually giving you news. The gist of all this stuff is going to come as we go forward. I think China is going to blow in the next 6 to 12 weeks, said Michael Osterholm, director of the Center of Infectious Disease Research at and Policy at University of Minnesota, in a Thursday webinar. Instead of falling off a 5-foot cliff, we're going to watch them fall off a 1,000-foot cliff. And that's very interesting, from a 5-foot cliff to a 1,000-foot cliff. A raging pandemic in China could be bad news for controlling the virus in the US, he and the other expert says, because the travelers will arrive sick and the chances of mutation increase anytime a virus infects a lot of people. Now, this is something which I think US will be worried about as a first stop, and I think the rest of the world needs to be worried about as at the second stop. It has to be looked at very carefully. The Chinese travel, especially in India, we need to be careful. Please understand, we don't know what's happening there. There is no clue. I'm reading certain news that comes out of one source or the other. That is an analysis. I really don't know what's happening on the ground. And if I am to believe the videos that I see online today, it's bad. What is likely to happen in China? One model predicts that China will see 100 million symptomatic cases, 5 million hospital admissions, and up to 1.6 million deaths from COVID 19, not counting the strain on the health system, which will lead to even more tragedies. And this has happened even during the last lockdown. As a matter of fact, one child and an elderly lost their lives in Beijing, and there was a huge hangama in the Chinese Weibo, which said that, boss, this and that and the other, this is not acceptable. Authorities actually had to apologize for that mix up. Now, here is something, after going through all the slides, I kind of wrote so that I could discuss with you. Um, why is China so vulnerable to COVID 19 right now? I mean, natural immunity. Now, this is something a lot of people have spoken about. There have been studies about it. I just showed you one of the studies. And the Chinese itself have actually spoken about it and said, there is a certain problem in terms of the natural immunity for the tolerance of these viral diseases in China. And another thing is because of this harsh COVID 19 policy that the Chinese had, where they locked everybody in. Remember, a lot of people did not go out. And when a lot of people did not go out, they didn't catch the virus. When a lot of people didn't catch the virus, they also did not get natural immunity. I don't know how many of us right now who are watching actually had the virus. I did in the first wave itself. What I realize right now is that probably gave me a certain natural immunity, and to a lot of people who got infected and got better. So that is something that the Chinese lack. If you are to believe their official numbers, That's a very small population and who had probably the virus infection way, way back. So I don't know. Vaccine protection has waned. Now, this is interesting. They started vaccination the first. I don't know. I mean, they claim to have started the first, and they claim that they were jabbing every person on the road and this and that and the other. They planned a third booster. They're talking about a fourth, fifth, and a sixth booster, a whole lot of things. But the last drive, as per my, you know, research, in terms of the booster, was about 6 months ago. Now we know these vaccines have a solid efficacy for 6 months or 9 months or a year if the vaccines are good. Uh, but these are Chinese vaccines where the efficacy has been turned out to be 3 months in a lot of cases. There's a mismatch there. So the Chinese can keep pumping vaccines into people's arms. What you will realize is that the immunity would begin probably now when the Chinese are putting the fresh wave of vaccination because of the efficacy of their vaccines. So it's actually China starting their entire vaccination program right from zero. That's a bad thing for a country that's planning to fight a surge of especially a highly infectious variant like Omicron. Lack of trust. Now we discussed this. I also want to add in a little bit here. The Chinese innately don't trust the CCP, and that's something that we could see in terms of the protests. People were upset, and today, if the same CCP is going to give them vaccine and this and that and the other, there's going to be a certain problem. The Chinese have had very weird instances, and I remember watching a piece on this about a year or two ago when there was a poisoning that happened in milk powder. And when I dug into it, milk powder was a very regular feature in China where these kind of poisonings would happen to small children. It was not some a one-off; it was a regular feature, and they spoke about one incident, two incident, three incident, four incident. So there's a certain lack of trust, and I say here also, patients were given fake or adulterated COVID-19 vaccinations. Now, why did they do that? To meet a quota or whatever it was, I don't know. Or somebody smuggled some stuff out of China into I don't know where, and they just put in some water to people or whatever they did. But there are reports about this which have been reported in the South China Morning Post, by the way, right? Vaccine misconceptions. Now the government prioritized one thing, which is very funny. If you read, also prioritize vaccinating young, healthy people, which fostered a public belief that vaccination could be dangerous for the older people. Now, what happened in India? India said, yeah, there is a vulnerable population. Who's the vulnerable population? The elderly. सबसे पहले उनको लगाओ. I remember March 1st, we started vaccinations, 2021, and सबसे पहले the 60 plus got it. The healthcare workers got it. The armed forces got it. The China went the other way around. They said, no, 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 we will vaccinate the young people because they are our workforce. अरे भाई वर्कफोर्स तो वैक्सीनेट कर रहे हो उसके बाद उसको दरवाजे में बंद कर दोगे तो क्या फायदा. So it didn't make sense. I mean, the world was scratching their ear like this. The Chinese wanted to do it like that. So it's insane. So these are four things that I find are the key in terms of their vulnerability. As I'm talking to you, there's a fifth thing that comes to my mind. The fifth thing is a lack of an understanding of the virus, how the virus spreads, how localities can be locked or localities could be contained. What is the behavior of this particular strain? They've not seen it spread, and they're going to see it spread at a time when the people are not vaccinated. They don't have hospitals, they don't have ICUs, they don't have medicines, they have a shortage of blood, and I don't know what else. I'm not even talking about oxygen generators and oxygen cylinders and this and that and the other. What is the Chinese Communist Party thinking? Now, this is the questions I want to ask, which is the main gist of these two slides are the main gist of what I want to talk about. So the Chinese basically said, okay, fair enough, protest ho rahe hain yaar. Let's open the economy, and the economy, will get people to work and economy will climb. Was that the thought process? I mean, world over, we've seen India today, the business levels have just started to come back to pre-pandemic levels. The Chinese probably said, it's a switch, let's just do it. We are a big this thing, big that thing, big this thing. So I think they've literally not thought this through. How a factory is going to suddenly start this? Do we have the energy for it? Do we have the raw materials to produce so much? Forget everything else. Are people asking for our goods? I don't know. That's when it brings me to the next question. Was it desperation? We know the Chinese economy has been slipping. Their foreign reserves have been slipping. Their trade balances, okay, India is another point, but there are issues. Decoupling is happening. A lot of problems are taking place. The BRI did not give them a single penny. Yes, they've got a port in Sri Lanka. They've got a, I don't know what with Pakistan in Gwadar. But as time goes by, those things are going to get old. When they get old, they'll need maintenance, they'll need manning, they'll need security, they'll need spares. For a port in Sri Lanka that does not take 35 ships a year, the Chinese are going to end up actually increasing their expenses as time goes by. So, is it the desperation of the economy that the Chinese are worried about? Of course, the next question I ask is China ready? Do they have, are they now in the past week they've spoken about, okay, yeah, let's make ICUs and this and that. Are they even talking about ramping up? Are they even talking about the second, third, or the fourth wave? And I mean, even if the third wave, as was predicted in this model, will the Chinese be able to vaccinate their population in 3 months? With vaccine hesitancy, with all sorts of fake stuff roaming around, with a little, I would say, I'm not saying little, but a lot of lack of trust with the government itself. Which brings me to the major question that I want to ask. If the you know what hits the roof, will China lock itself again? Now, that, guys, is the big question we need to ask. Now, there are 3-4 issues which need to be kind of spoken about. One issue is I spoke about was the mutation, right? Now, when we talk about mutation, one of the biggest things we are going to be looking at is that if the Chinese are going to let this thing loose into their population and this thing starts mutating. As a matter of fact, there's some virus that Dr. Anand Ranganathan tweeted about today. It'll be, during, let me see if I can just pick that up. He said he talked about some particular virus that is kind of a new strain which is spreading into China, and he said there's going to be a bit of a challenge in terms of, it's somewhere buried down, so it's going to be difficult for me to find it. But anyways, I'll kind of tweet it out. It just stuck to my mind, so I thought I'll just mention it here. But it's a challenge. If a new strain like Delta comes out of China, then the world has another thing on their hand. We've had the COVID pandemic, we've had the war in Ukraine. I don't think the world has the capacity enough to take through another issue coming out of China. I don't think it's going to be the Chinese that need to lock themselves. I think it's the world that will need to lock China at a certain point of time. Because if this is how irrationally that the Chinese Communist Party is going to behave and literally want to infect everyone, like Boris Johnson did at the beginning of the pandemic, it's only after he landed up in the hospital that he said, nahi yaar, ye theek nahi hai. I'm sure the Chinese Communist Party has had all the best vaccines in the world. They steal all sorts of things from people. I mean, for God heaven's sake, steal someone's vaccine formula and fix it. Not for yourself, but for the rest of the world. Because if this thing leaks again, there's going to be challenges for the rest of the world. That's the gist of the story that I wanted to bring about. We cannot actually say, oh, China, mar raha hai yaar, bahut acha hai, bahut. Boss, there's going to be challenges. For us, it's really worrying because they are neighbors. Our soldiers keep fighting with the PLA soldiers. What if those guys are infected? I mean, you'll find another wave coming into China, coming into India, along with a whole lot of things. Something that we need to think about. Guys, I'm going to start taking your questions, comments, thoughts, whatever you want to. Before I do, as I always say, please like this video, subscribe, check the bell icons. And yes, if you can, do help out the Dev Talks efforts by joining or some super thanks, or a direct contribution to me on the UPI. Don't forget to visit my website where I've put up a lot of, whatever I write about in terms of my thoughts. And the website also has categories of videos that you can easily search if you're looking for any particular subject. I keep getting a lot of queries where people want to see some particular video which is about a particular subject. Easiest thing, go to thedevtalks.com, type whatever you want to, and you'll get the entire thing right there. Most of the things I name very, very straightforwardly. I think most of you would have realized. I don't try and do too much of a clickbait so that it's easy to reference to when you go back, because you won't remember the pun that you put out in the uh, clickbait at this particular point of time. Right. Thank you so much for the first comment. As a matter of fact, he commented before the show even started. He's in for a time of his life. All his management skills will be tested now. Indeed, and ours too, sir. Let me be very clear. The global supply chain also is going to have a wake up call with that paper credit and UCP being tested. Insurance also, the financial system have to see how many will be taken out. Let me add some stuff, and see, the oil prices actually reacted to the Chinese opening up. They kind of stabilized and stuff like that. Now, if the Chinese sink again, there's going to be lack of demand, and the OPEC and Russians and all that stuff will say, yeah, lack of demand, prices are falling, bloody hell, cut the this thing. They'll This whole imbalance in the pricing will continue. As it is, we've got an imbalance because of the war which is taking place. This will be another one. You also say interesting times for the straits. Well, I think we discussed this with General Narayanan on my show, where he says that it's quite possible. There are these little islands which are very close to the mainland. What if the Chinese just decide, yeah, chal, le lete hain. Create a small little incident, create nationalism fervor? Was that one of the purpose why they did what they did in Tawang? God knows. A lot of us actually believe that. We say, yeah, probably they're trying to externalize their internal issues, and that's something we've spoken about. Bodies are being piled up in Chinese funeral homes and hospitals should be of concern to all of the world. Exactly my point, sir. Yes, we can look at them and smirk, but remember, they're human beings. One, that's the moral part of it. There's our next door neighbor. So if they explode, there's going to be a lot of splinters that will come our way. We need to understand that. Agency assigned to track cases in China has given up. They've stopped tracking the boom in active cases. Yeah, I covered this. They're saying only symptomatic cases. In India, we have free press, which has highlighted our shortcomings, which helped us improve our response. Satyam, I'll be honest with you, the Chinese write quite a bit themselves. The only thing is, we don't follow their websites and stuff like that. If you just read South China Morning Post, you read their Xinhua News and stuff like that, you will find that they talk about a lot of things. They'll of course, you'll have to read between the lines and know a little context to analyze it, and that's where the Chinese analysis becomes a little tricky. Pakistan, we all know, right? That's the problem. That's the advantage. We know the history. We've fought wars with them. We know who's who. We know Imran Khan ki biwi ka bacche ka naam kya hai. All that we know. The Chinese, we don't. That's the only thing, and that's kind of the reason why we find it a bit difficult. But the Chinese speak a lot. One has to just read between the lines. Amay, Chinese would now understand mocking is easy, but making a proper working vaccine is hard. Absolutely, there's no question. And honestly, if they politely ask someone, somebody will give it to them. But the arrogance of the Chinese leadership will not let that happen. Because please understand, if the Chinese need to go somewhere and get vaccines for themselves and say, no, please de do yaar, hamara problem ho rahi hai, they've lost. They've lost face in front of the Chinese people. And then I don't know which color paper will come out this time. Last time it was white paper. During India's COVID crisis, we did take help from the international community. CCP will lose face. I didn't know you were going to type this, but yeah, exactly the point. Apart from that, Xi Jinping will lose face. What will his Chinese Communist Party people tell him? Oh yeah, well done, Xi Jinping. You've cost us our entire progress. It's going to be challenging. Will China seek India's help? Yeah, sir. I don't know if all of you will remember when during I think January end or early February, India's actually sent medical supplies to China as a gesture of goodwill. When the pandemic started, we sent a lot. Now I can't confirm this. I mean, I'll have to do a lot of research to dig this out. But I actually, during the lockdown, there was a lot of time to dig. I actually read a report which spoke about the Chinese when they realized that they have a pandemic on their hand. They came to India and bought off all the PPE ka material. A lot of it was lying in India because it's not being used, and there was some Chinese guy trader who came, picked it up, and went off and kind of left us with pretty much nothing. There was the same for certain mask stuff also, a certain filter that goes into the mask or something like that. They did a lot of this stuff because they realized that there's a pandemic, and they didn't tell the entire world because they were trying to prepare themselves a little better than the rest of the world. That was a bit selfish, there's no question. But seeking India's help, sir, I think they'll rather seek American help. But India, no, they'll look. The Chinese have this arrogance, so they will never look at a country that they feel is inferior to them. Of course, they feel everybody's inferior to them, but Indians especially. So yeah, that's just a mindset. What about the PLA? Is it not affected by a COVID outbreak? I don't know, sir. I'm sure they are. I mean, what they took the same vaccines as everyone else, so why not? You saw them actually coming to the in that particular video that we saw. They were all wearing masks. I mean, yeah, the Indian soldiers are beating the nuts out of them, but they were wearing masks. They were all covered up. That tells you the kind of you know यार जा रहा हूँ हिंदुस्तानियों से लड़ने के लिए मास्क पहन लेता हूँ यार you can imagine the mindset of the people there, right? These numbers of millions of dead in just 12 weeks is probably blown out of proportion. Well, I don't know, I'm just telling you what I can see. They said the same thing about India, but we didn't see millions die. But yeah, India have far better immunity. See, Amay, one is immunity. Second is, see, India planned for it. India prepared for it. India, there were a lot of flaws, and we can do a whole episode talking about that. But there were a lot of good things as well. We became, during the first lockdown, from manufacturing of nothing, we became the second largest producers of masks and PPEs in the world. And that was a big turnaround considering the kind of cases that we had and the number of doctors that we had to dress up. So yeah, I mean, India did prepare for it. I don't know how much China has because they won't tell us. So it's going to be difficult for us to analyze. So I think the CCP has lost its face, and I think it will steal vaccine from the USA and its healthcare. Not and its healthcare is not developed to the situation like India to face COVID like providing vaccine to like India did. Okay, I think I get what you're trying to say. Is see, there's the preparation for something like this took a while in India, and a lot of people did get frustrated. There were articles and op-eds written, if you remember. There was a whole cabal that got activated and said, "Yaar, ye nahi hai. Indian government is not doing. The Indian government not." Everybody likes to criticize. There's no question, but there were opportunities as well. I am not denying that fact. Everybody will make a mistake. Like, for example, the initial rollout of the vaccines in India was a complete disaster. The state said, we'll do it. Then they kept some stock here. There's not until and unless the central government got into it and created a central effort, did the vaccines come into, a scene where everybody just said, okay, now we're going to get vaccines. So I don't think the Chinese have gone through that entire rigor, and I don't think they've learnt anything from the world. If they had, they would have had gradual reopening. They would have taken 10-15 days to prepare rather than just say, Kal subah se khul gaya. Oh, we have a new member. Thank you so much, Mr. Sudeep, for becoming a member of Dev Talks. Welcome to the group. If you want to, you and anybody else who would like to join my WhatsApp or Telegram group, please do send me an email on the email mentioned in the description. Telegram is easy because one, if you kind of Worried about a lot of people getting your number, you can join the Telegram. It remains anonymous. uh, Twitter, I have also realized there's a, and we need to have an alternate as well, because a lot of nonsense is happening. And of course, the WhatsApp group is already there with about 120 people strong. Some great guys talking about a lot of geopolitics all the time. The Telegram group is a one way where I send out some notifications and some news. The WhatsApp also, I put across some of the news. So if you guys want to join that, please send me a mail with your number and a way for me to verify who you are. Are India's borders still open to Chinese travelers? No, sir. Tourist visas in China was stopped about, I think, a year ago. So yeah. The only thing I'm wondering is, if things get worse, will Indian government have them, considering how they've been acting recently on the border? You don't know what situation lands. I mean, before, let me put it across another way. Before the Indian government actually steps in and does something, a lot will have to go wrong in China. I mean, I hope doesn't happen. At the end of it, they're human beings, but yeah, that's what I feel. A lot more will have to happen before the Indian government actually steps in and says, "यार हम अभी कुछ करते हैं इनका." China must be thinking, "मैं नहीं तो कोई नहीं." I hope they don't. I mean, we can't go through that nonsense again. So it's something that we need to kind of avoid. Uh, right, Kiran, you say the hard truth is that there is no appetite in the European Union to confront against China. They didn't learn anything from COVID. Exactly my point. They just didn't. The Chinese seem to think that we know best. I mean, it's our virus, if I may. Yeah, jokes apart, the Chinese did not. Absolutely bang on point. They've not picked up anything. Now, funnily speaking, and this is something, since you mentioned Russia, it strikes my mind. Why don't the Chinese just pick up, that Xi Jinping picks up his phone and calls up Putin and says, "Yaar, Vladimir, thode vaccine bhej de bhai. Russia and China, no limits partnership. So what's the problem?" If anybody from the Chinese government is listening in, and I know you guys have put some pet monkeys around me to kind of keep putting certain things around in the place. But anyways, if you are, please tell your leadership. That's something you can do. Call up Vladimir Putin and say, "Give us some vaccines." He'll be glad to. So we did extremely well with the way we fought the pandemic, better than any of the developed countries. One of the reasons that is our ability to be flexible and adopt as per the certain some circumstances. Absolutely, as a country, one of the things that I really felt was, as a country we came together. There were elements. I mean, we can always criticize that, but as a country we came together. When it was told to us, "Yeah, wear a mask," people would wear a mask. There were no stupid non-maskers roaming around. Nahi yaar, it is not scientific. And everybody said, "Yeah, theek hai. If it's not scientific, if I have COVID, I'm protecting someone else. Let me just do that." In India, that kind of thing was there, and that's something that helped us. But in the West, it wasn't the case. There were these all sorts of movements and all sorts of Librandus that were roaming around there, and you know what happened after that. So it's ridiculous. Right, coming towards the end of the show, if China outbreak with a few fatal variants leads to a global pandemic again, our G20 plans will be in jeopardy. I don't think so. I don't think so. I humbly disagree, because remember one thing: we have built up a certain resilience, and I'm sure there are war plans which are being made as we speak. So if this is something which is coming into mine and your mind, I'm sure it's coming into a lot of other people's mind as well. So let's kind of trust ourselves and trust our people, and it's something that we need to learn. We've done well, and we need to acknowledge it. Even if there is another wave that keep even if there is another wave, we have that capability to sustain. Of course, yes, and all of us. I mean, I'm 3 times vaccinated, so a lot of us have had good amount of vaccinations, and we've got some resilience to it, because a large part of our population did get sick. So there is natural immunity. To be honest, we are lucky. Chinese are not exactly excellent in making vaccines and viruses. I don't think so about the virus. I mean, seriously, man. Imagine if they were very good, have created something far worse than COVID. साहब माफ कर दो यार. I mean, रात को नींद नहीं आएगी यार. Far worse than COVID. I mean, yeah, there are terrible strains of Ebola and stuff like that that we've seen. I just hope the Chinese are not doing anything like that. I think a year and a half of all of us sitting at home have given us a lot an opportunity for people like me to actually interact with so many people like you, because it was during the lockdown that a lot of people opened their channels, including myself. So good things came out, but of course, a lot of bad things did as well. So, but I've said this in multiple occasions. I'm going to say it once again. If there's a graph anywhere which is there, the point of time when the pandemic started is the downfall of China. And the point of time when the pandemic actually started was the time when we started showcasing to the world what the real India was. And I'm going to take just one last question. China is making EVs, but Gadkari ji says hydrogen vehicles are the future. What do you think? Sir, I would rather recommend to you, and fair enough, I'll take this question, of course, out of topic, but I will recommend to you, please do the research on how a battery is made, how electrical engine is made, what is the kind of material that is used in that, what what are the kind of environmental damage that that material does, and how are we supposed to actually recycle the e-waste. This is something that Mr. Gadkari had spoken about, where he said hydrogen would be a fuel of the future because the engine is similar to a normal internal combustion engine. It does not have a residue, it does not have spare parts, it does not have any um, poisonous chemicals or anything like that, or any e-waste that needs to be left behind. In India, we have a problem with our garbage. There's no question about it. Look at our streets. I don't think more batteries on the road are going to help us. So yeah, the world is kind of shifting into the EV. There's a lot of politics also behind it. I think the hydrogen fuel seems to have a lot more promise. That's all I'm going to say about it, guys. One last message from me, from Dev Talks, to all of you guys, and please spread it across. I'm going to say this very often, and this particular thing is the most important things for us. The Chinese trade balance, we can keep blaming the government, ladies and gentlemen, but it is our problem. We are the ones that order these things. We are the ones that consume these things. We are the ones that go on to Amazon and get trinkets for ourselves made in China that we don't even need half the times. We spend money because there was a whim, there was a fancy, we saw it somewhere and we liked it and we wanted to buy it. Please, 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 let's stop doing this to ourselves. Let's please curtail the purchase and sale of Chinese products. That's the only way that we can stop our government from actually not stop our government, help ourselves balance this trade deficit with the Chinese. This trade deficit always comes up into question whenever there's a clash on the border, and we need to ensure that we support, if nothing else, our soldiers when they're fighting right there on the borders by not buying Chinese products. Thanks a lot. It is, you know, thank you, Mr. Manoj, for your agreement. Yeah, I've done a little bit of a research. Don't like to get into this subject. It's not defense related, but he asked a question. It was a fair question, and it deals with a lot of trade and stuff like that. I wanted to, Satyam, I'm sure you bought a laptop made in China. All the iPhones are made in China. So do I. I'm not saying I'm also as guilty as all of you guys. So, or anyone else for that matter. But going forward, let's just stop it. And this is something that me and General Shankar had mentioned during the time when we were talking about this standoff and this fight that happened in Tawang, and I'm going to kind of repeat it as much as I can. Guys, thank you so much for joining in, being participative. It's always fun talking about various different issues. I hope you also, please, if you guys haven't seen, please check out the video. Today was a double feature because I didn't put anything last night because of the match. Today was a double feature. The first one was about globalism and how China took advantage, how China fooled the West into its own growth. Check that out. Lieutenant General PG Kamath, some insightful views. Today's Monday. I have some amazing stuff lined up for us in this week. There's going to be a history, go back to history with Colonel Ajay Raina. We will also have General Shankar. We will talk about Pakistan. And of course, we'll try and do an analysis by the end of the week on either data and the theft of data, or what is happening in China, because I think the Chinese situation is going to explode. Of course, at Saturday, the weekend special, we will have Major General Rajiv Narayanan, who will give us views on a very interesting subject that we are working on. I'll not leave it out right now, but in any case, this week I'll also try and do a update on the Ukraine war and a little bit of research that I'm just about to finish on the Punjab and the issues that we are facing over there. So, till the time I present all that, thanks so much, guys, for joining once again. Have a great night and Jai Hind.